Welcome to hepatitis B and D. Now you would think, because they're in the same video, they're from the same family of viruses, but they are completely different families. Hepatitis B belongs to the hepadnavirus family, and hepatitis D belongs to the Delta variant family, which are RNA genome envelope viruses. But more on that later. So let's begin with hepatitis B, which are our hepatitis batty hippos that we see here in pink. This is a DNA virus, so it starts with our DNA at dawn background. This is a double-stranded DNA enveloped virus. So she has her dinosaur, which we used as a extra reminder that this is DNA and this is double stranded. So she's holding two reins to remind us of the double stranded DNAs. Hepatitis B can cause both acute and chronic infection. It is spread through blood in like IV drug use, sexual intercourse, or accidental needle sticks. This one's really special because it has a high viral load in the blood. So even the smallest, tiniest like needle prick or exchange of blood can cause an infection. Most often, people get the acute infection. That's 90 to 95 cases. It lasts 3 to 6 months. And the chronic infection is between 5 to 10% of the cases, and that's an infection lasting more than 6 months. This chronic infection can lead to the cirrhosis of the liver and hepatocellular carcinoma, which is why our hippos are wearing their liver tattoos. 80% of these liver cancers are due to a special protein that Hep B makes. It's called protein X. That's why our hippos have bedazzled X's on their floaties to remind us of protein X, which blocks P53. And as we know, P53 is the guardian of the genome, and once it's gone, then we just replicate like crazy, creating cancer. The incubation period for Hep B is between 60 to 90 days. It causes jaundice, fatigue, abdominal pain, loss of appetite, nausea, vomiting, and dark urine. In acute cases, you have a stronger immune response, and that's actually what you want because you want to get rid of this virus quickly. If you have a weak immune response, then it's more likely to drag out and progress to becoming the cancer and the liver cirrhosis. So, because it has a circular DNA, it needs DNA dependent RNA polymerase to transcribe its genome. So it goes from DNA to RNA, then back to DNA, and it uses a reverse transcriptase actually to do this. So it is actually the same reverse transcriptase that HIV uses, but HIV uses it to go from RNA to DNA back to RNA for its replication, and Hep B is using it to go from DNA to RNA and then back to DNA. So because they use the same reverse transcriptase, they can be treated with the same nucleoside analogs, which block viral reverse transcriptase. We do have a vaccine for hepatitis. It is a subunit vaccine against the S protein. It's made from yeast cells and it's usually given to newborn infants within the first 12 hours after birth. This is to reduce the chances of them becoming infected if their mom is Hep B positive, because if they are, they have a 15 to 25% mortality rate. So to prevent this, we just vaccine them within the first 12 hours of life. Okay, so moving on to hepatitis delta. This is a circular RNA virus. So here it's represented by the boys. They're wearing their RNA sunshine swim trunks, and they have their hepatitis delta D chains on. So, hepatitis delta is a strange virus because it's kind of like a parasite to Hep B because it will not infect a cell on its own. It needs to have Hep B there because Hep B provides it with all the like enzymes and proteins it needs to replicate itself. So, in a way, it's kind of like a moocher onto Hep B. 5% of people have a Hep B and a Hep D infection. And if you have this co infection at the same time, it increases your mortality rate by tenfold. So it goes from like 0.01% to like 1% fatality. And then you can have something called a super infection, which is when you have Hep B first, and then later on in life, you get Hep D. This actually increases your mortality rate 20 times that. So now you have a 20% fatality. Okay, so that's all I have for you for Hep B and D. They're both circular genome, except for D is RNA and B is DNA. Hepatitis B is the more infectious one. It can survive on its own, and hepatitis D is just a moocher, little parasite that hangs out around it. Hepatitis B can go acute or chronic, with chronic cases leading to liver cirrhosis and hepatocellular carcinoma. And we also try to vaccinate children within 12 hours of birth, just to prevent any cross infection with Hep B positive mothers. Okay, so that's all I have for you. Like and subscribe. Bye.